Good morning, everyone. I'm sorry if my throat sounds a little scratchy. I think I'm in the process of losing my voice. Um, but I am pleased to open up our September 18th, 2025 meeting of the Joint Board of Health and Hospitals. As we start our meeting at 8:03, I'm going to begin with taking a roll call so we know which board members are present. If you could say here or present when you hear your name called. Dr. Ludi?
Here.
Brittany Jones? Dr. Daly? I know Chris is here, yes. Sorry, I am looking at a list and not necessarily at my screen.
I didn't unmute, I'm sorry. Present.
Dr. McNicholas?
Here.
Dr. Shockham?
Here.
Elizabeth Wright?
Here.
Dr. Tepe?
Here.
Dr. Shields?
Here.
Nebu, as I had mentioned earlier, is planning to join us later. Deidre Griffith, are you here?
Here.
Yay. So the only person I called I didn't hear present was Brittany. But I do believe she's planning to come to the meeting, so she may just be running late. Okay. Well, thank you for helping us get through that piece of the meeting. We do have a pretty jam-packed meeting. We had some items from our last meeting that we definitely wanted to ensure that we covered in this month's meeting. So I'll go ahead and ask for us to approve the August 21st, 2025 Zoom video as our meeting minutes. And then we will hold off on any intros of new members until Nebu is hopefully able to make it later. We'll have our department updates, committee updates, and then I do have some exciting updates about our engagement strategy with Mayor Spencer. All righty. So first things first, approval of the August minutes. Do I have a motion to approve?
So moved.
Is there a second?
Tapey second.
All in favor of approving the Zoom video as our August 21st minutes, please say aye.
Aye.
Are there any nays? Are there any abstentions? Hearing none, the motion passes. Thank you. All right, I'm going to turn it over to department leadership. Really excited to hear about progress and updates on the CHIP and also on the quarterly update. And I didn't get any follow-up questions about the last meeting, so we may just move past that. But I will turn it over to Victoria and whomever else on your team you would like to speak on CHIP.
Good morning, everyone. We're excited today to have Kat Pittman on the phone with us. She will be presenting the CHIP project that she and Rhonda Bartow are really actively involved in. So over to you, Kat.
Hey, hi everybody. I'm Kat, new here at the Department of Health. I am the CHIP coordinator. So I get the privilege of working with each of the CHIP action teams and really helping to hopefully move their work forward. So we'll get started here. We'll share my screen. Okay, can everybody see that okay?
Yes.
Okay, perfect. All right, so just a review, these are our CHIP priority areas: intersection of health and economic mobility, chronic disease, maternal and child health, violence prevention, and behavioral health. And then we have our cross-cutting themes here that kind of encompass or umbrella over all of those areas. And I'll let you kind of read those. And I'm sure this is just a review, so I'll go quickly through that. And so our first slide here is the intersection of health and economic mobility. Our co-leads for this action team are Julie Gary and Christopher Nolan. Here are the most recent CHIP activities. A big focus, obviously, is housing. And the last housing meeting that Rhonda and I attended, here are some things that were brought forward. State Representative Kimberly Ann Collins, she is really pushing for many of the vacant apartment buildings that for people that were displaced by the tornado to kind of be renovated to be used for suitable housing. She's also into pushing more advocacy for housing by convening some town halls. And one of the big things is that she is requesting that we bring some stories from the field or individuals who had that lived experience to testify at the Capitol on that legislative proposal. Alicia Saunier, not sure how to pronounce that, I'm sorry. She intends on putting a bill forward to use RAMS funding for housing. That was mentioned also during that meeting as well. And then I just recently spoke with Dr. Gary from the IHEM action team. She's one of the leads. And she mentioned that Alderwoman Daniel Velasquez shared some things on St. Louis Public Radio that there is intentions to put more structure in place to fee and fine absentee property owners. And this could also ensure better quality of life for those St. Louis residents with those stricter laws in place. Does anybody have any questions about what's going on with IHEM? I'll keep going. All right, so we got chronic disease here. This is Rachel Bartnick and Lauren Landfried are the co-leads on this team. One of the big things is they've got the hospitals now using the SDOH nutrition screening tool. So that is actually in place and it is working. And I will be getting a summary statement of that coming from Rachel next week. So I'll have that as well to share. Food is Medicine is an initiative that has taken off. If you don't know what that is recognizing how important nutrition is in preventing chronic disease. The DHSS presented on this project a few months ago, and it has taken off. So all is going well with that initiative. The team has now determined that they have 5 strategic priority areas that they would like to focus on. And those are policy advocacy, community outreach, expanding access to food services, education and health literacy, and partnerships and collaboration. Most of these plans are kind of living documents. And so a lot of them are really fine tuning their action plans and deciding really what those priority areas are to focus on. So that's good. Moving forward with their strategic plan for chronic disease. And then we've got Operation Food Search is another program that's going on. They're really trying to partner with community organizations to get food available, more accessible and available for community. And since with Double Up Food Bucks not being something that is being funded, they are just searching for, other directions and other organizations to partner with. And Operation Food Search is one of those organizations. Any questions so far? I'll keep moving on. Okay, going to MCH, Maternal and Child Health. Co-leads are Dr. Elizabeth Daniels and Rose Anderson Rice. Some of the activities that are going on, they just had their first community listening session yesterday. They had, oh goodness, probably about I want to say 7 moms that showed up. It was a really packed, it was over at the Karate House. And it was a great turnout, really small little community listening session. So very comfortable, everybody felt comfortable to share. And some of the things that came out of that session, I wasn't able to stay for the whole session, but the first hour I was available, I was able to stay. They were discussing how the prenatal visits are just really, really too fast. A lot of the moms feel like their voice is not being heard. They're kind of rushed through the appointment. And also transportation is a big deal as well, getting them to their appointments. So those were 2 things that came out of it. I know Ebony, who is on that subcommittee, will have a lot more to talk about with that prenatal care. So the subgroups that they established here is the doula and CHW, patient navigator, policy advocacy, and health education literacy. So those are their main subgroups that they are focusing on. In other news, they're distributing large amounts of diapers through their diaper bank and outreach efforts. Post-tornado, they're working on emergency response efforts, putting together some postpartum emergency kits to aid in any other natural disaster situations. Moving on here. Sorry, violence prevention here. The co-leads Serena and Jessica are on this team. They had a huge jam-packed summer with youth events. They had 27 youth events and about 1,700 total youth. It was very successful. They have a lot of good things to say about it, and a lot of great data that will be coming from that. They are getting ready to launch their new opportunities for wellness, their Black Healers Collective. That is something that they have been working on, and it will be ready to launch here soon. Their Handle with Care trauma-informed system is now fully launched in schools. And that one I was just learning about it from Jessica recently, is when a child is exposed to violence or trauma, a law enforcement officer or first responder will send Handle with Care notice that says 1 or more children were on the scene of potentially traumatic incident within the past 24 hours and could exhibit academic, emotional, and/or behavioral problems as a result. So that lets them know that they need to be handled with care. And it's completely confidential, and it's sent before the start of the school day. So that's fully launched. Behavioral health here, we have our co-leads Bill and Katie. They just recently went, they're working on getting the right people in the room for their different areas that they are focusing on. They've come up with 3 different priority areas: Medicaid policy, community education, and systems level navigation. So they're also working on fine-tuning their plan as well. But they are starting to meet more regularly. A lot of us are invited to their meetings, so we're able to stay up to date on that. They're working really hard on the Medicaid policy right now. And then moving on here, we have our CHIP mini grant update here. We have received the accreditation funds, LPHA accreditation funds, and we'll be using $74,000 towards mini grants to support our teams. So we've got application and budget logic model ready to go for that. I'm just waiting to get that approved. And we've partnered with the mental health board for this. They'll be the fiduciary agent. And we're hoping that all of our teams will come up with those areas that they really want to focus on that they can use these funds for. And one of the main goals is just kind of giving them more of an incentive to kind of report out and get that data. We're also asking for, some presentations that we'll be able to use, some stories, lived experiences as well that will go along with the requirements for this grant. Moving on here. And last one here, I did put a slide in here. A lot of the CHIP teams, they're working really hard. They're all doing other things besides just working on their CHIP specific areas. And they have a couple asks just to help kind of move their work forward. So I kind of broke it up for each team here. We've got MCH. They are navigating technical assistance for doulas enrolling in health plans. That's one of their issues that they are working on, and they're asking for, any assistance in that area. Behavioral health, mainly all the Medicaid changes. Some of the questions are, how do we help people get enrolled and re-enrolled without the funding to do it? Obviously, that retention is very important. And how can we, get the community health workers, FQHCs, and those community groups providing behavioral health services, helping them understand how to file every 6 months to, keep those benefits going. And so obviously everybody needs to work together. So really figuring out how to get it to be a coordinated effort among all the organizations. One of the main things also, just regarding the work of the action or the action team, is helping to build that buy-in. So really framing the big picture so that more people will kind of be motivated to push the work forward and get it done. And also so that it's understood by everybody that's working on it. Chronic disease, they really just need help with administrative CHIP work, organizing meeting notes, gathering data. That's just kind of one of their big asks to help to move that work forward. And then IHIM here, they are continuing they had that momentum, on the new year with regular meetings, working towards their objectives, but due to elections and the tornado, it's taking different shapes. So really just, they need help getting the right people in the right room. And then Violence Prevention Commission right here, they don't really have a big ask. They're doing pretty well with getting their work to move forward. So that is all I have. Does anybody have any questions?
Yes, thank you, Kat, for presenting. This is very informative. We get a chance, can you please send us these PowerPoint slides?
Yes, I sure can.
Thank you. And in
You're
April,
welcome.
just a request, could we possibly get the slides before the meeting so we can prepare?
Victoria, do you want to address how your team either can share slides prior or a summary possibly of some of the points that you all will cover?
Sure, we can probably, as to the extent that they're ready, we can send a draft set of slides ahead of the meeting.
Thank you.
Thank you.
Hey, Kat, it's Deidre from BJC. Thanks for that overview. It was really thorough.
Hi.
Yeah, great to hear all the great work. Is it possible to get a membership list for those various committees? Because I know
Sure.
I have BJC representation on a couple,
Yes.
but I'm not sure about like maternal health and so.
Sure.
Okay, thank you so much.
Yes, I can get that for you. Yep.
Thank you.
Deidre, you just asked the question that I was going to ask. I do know several folks that are a part of some of the action teams, but don't know everyone. So if like one of the asks is to get the right people in the room, my question was really, well, who exactly are you seeking to put in the room? Or, where are there stakeholder gaps, maybe? So if that's if there's a little more detail about that would be helpful. I think this group, this board is connected in many ways, and I know there are people on the board who are part of some of these action teams. But just whatever we can bring to this work, we would love to.
Okay, great. Thank you. I'll make note of that.
Does anyone else have some questions?
I don't have a question. I just have a comment. I appreciate this presentation, Kat, and I have been co-leading a local collaborative called Empowered Thriving Communities, in which Craig is also a part of, and has uplifted the work that you all are doing at the city. And we are particularly excited because our collaborative, while it has various members within different sectors, the largest sector we have is food, folks who are in the food system sector, local farmers and growers. And so they've been interested in being more involved in local activities related to chronic disease and food, and also wanting to be more involved in food as medicine. So I have reached out to Rachel. She has sent me the calendar invites for the upcoming meetings. And so we're really excited to be able to uplift some of our experiences and expertise and figure out different ways to kind of plug in some of our localized farmers and growers. So thank you, Craig, too, for the plug-in and getting this started for us, too.
Awesome. Thank you for sharing. That's exciting.
Colleen just made a comment in the chat that she, along with, I think all of us think that the Handle with Care program is important and needed. I do have a question about whether that program is in all public schools, including charters, and is it being offered to private schools?
That's a great question. I can find that out for you. I'm not 100% sure, but I will definitely find that out. Yep.
Hi, it's Inbal. Hi, Kat, this is great. I wanted to help you fill the needs that you listed. I really appreciate that you outlined the needs for some of the action groups, not just the people, but what you need to get done. So I get to chair the subcommittee on academic health partnerships, and I would love to figure out how to help you. So let's follow up. Thanks.
Wonderful. I'll follow up. Thank you, Enbal.
Yeah, absolutely.
My final question is, so for helping folks, enroll or complete their re-enrollment every 6 months, is the primary challenge the lack of navigators? Is it that more navigators need to be trained? Or is it this is purely a funding question or challenge?
I'm going to let Craig, are you on?
He is.
Okay. I
am.
think Craig can probably answer that better than I can.
Yeah. Well, I wish I had all the answers, Kat. You're doing fantastic. Thanks for the presentation. I, I, I I think it's a combination of those things, and we can ask further. I think Kat will ask further in terms, because I think we're in the exploration of that. Certainly, the navigators, some of the navigators that existed are no longer being funded, apparently. Um, a lot of it could be the education piece. So I think they're struggling with that to try to determine that so they can best provide that. One of the things that came out of the last meeting is that the CHIP group is probably not the one to actually do that work, but to bring it to attention so that it can be handled almost like the expansion was handled in the past when Cover Missouri was doing that. I know that
Well, thank
doesn't
you.
fully answer the question. They're working on it.
Okay. Thank you. Well, this was great. I'm so pleased to meet you, Kat. I feel like we may have met at some point in the past, but this is really helpful. And what's the best way for the board to stay abreast of all the things that are happening with the CHIP in case people want to engage with an action team or want to connect folks? Are you the point person that people should be going through?
Yes. Rhonda, do you want to just confirm that?
Yes, Kat will be the point person. And the other thing that we are working on is the Think Health STL website and trying to get it updated. And on that website, we currently have listed some of our performance metrics, and the action plans are there. And we're moving towards developing stories that we can put about the action team activities. And we also are going to be expanding and including a report, a health equity report, and we've got some performance metrics and data specifically related to health equity that will be coming on that website too.
Wonderful. I think that'll be really helpful. Kat, do you mind dropping your email in the chat? I will share that out with the board when I send follow-up notes, and then folks will be able to reach out.
Can I ask a quick question, April?
Yes.
It's Melissa. Kat, do you know kind of the roles or the roles of all the board members, right? Or kind of where we work or where some of our our
don't-
networks lie, right? Because it's one thing for me to like reach out to various people at the health department. But it would be great, like if you knew I worked at a community health center, right? So like if
Yeah.
you want us involved, I'm happy to get to all of the CMOs, right?
Yeah.
Brittany's at the IHN, Colleen's an OB like GYN like I am. So our different, we got EMBL and academic. So do you have all that information as well?
I don't.
So that you
I
know
don't.
how to get to us?
I don't, but I would love, I would love all that information. So yeah, that would be great if somebody could send that to me.
April, do we have a list of something like that?
We do. I will make sure that the information I have is up to date and accurate though for
Okay.
people before I share it. So I will add that to the list of action items that I'll be sending
good.
out to the
Sounds
team.
Because,
Thank you.
right, use us for our
Thank you.
networks, right? That's what we're,
Yes.
Yeah.
we all want to be engaged. So, yeah.
Thank you.
Yeah. Well, this was wonderful. Thank you. Looking forward to engaging and being active more in terms of connection or whatever needs we can fill, but also hearing about progress as it's taking place. So, all right. Victoria, do you think you're ready to move on to the next item?
Yes.
All right, we're going to be focused on the quarterly report.
I'll be doing that presentation, so let me share my screen. Okay, can you please tell me if you can see my screen?
We can.
Yep.
Yes,
You can, okay.
thank you.
Okay, so as you know, we usually provide monthly reports to the board, but we've switched to providing, we usually provide monthly, written reports, and we send those out. We switched to now doing this quarterly. The main reason is because each data points can be taken into context over time, allowing leadership to see what's working and what needs improvement. So from now on, we'll be sending these quarterly reports out instead of monthly. You should have all received this already. This was sent out via MailChimp survey. And so I'm just going to run through some of the high points of the report. So our communicable disease HIV prevention has exceeded its monthly goals for residents tested for HIV and other STDs at the health stop. They've improved throughout the quarter with on-site testing via health vehicles and outreach events. They were able to refer 200 clients for PrEP services and referred 100% of STI positive clients to treatment, to physicians for treatment. Our disease investigation and tuberculosis Hep B monitoring sections continue to review reports and ensure that we have a timely notifications of any concerns. Our tuberculosis monitoring section continues to improve patient wait times, and we're within 5 minutes of the target each month. Family Community School Health in the second quarter, the health education team has already exceeded its goal of hosting 18 men's health presentations annually. So far, our community health workers have participated in more than 100 events, outreach events, and they're on track to exceed last year's participation. Currently, we are not meeting our target for the number of women of childbearing age being tracked and guided through the Show Me Healthy Woman program. And the Wise Women program. We also have been inconsistent in partnering with community organizations to host women's outreach events. A large part of this is related to the level of security and vetting process that is so much higher for the women. We are close to reaching our monthly target for lead screening. For lead screening in children 5 or younger, but we are not consistently meeting our monthly target of 80 individuals. However, we are exceeding our monthly target for home referrals sent to the building division for lead remediation. Through our partnership with Affinia Healthcare, we have set a goal of providing 20,000 vaccination of school-age children per year. We've exceeded that number in 2022 and 2025, but we didn't reach it in 2023. Halfway through 2025, we're still short of hitting that target. So with almost a little bit over 500 vaccinations as of June. Behavioral health, the main priority of the Bureau is to link residents through community partnership and organizations. Our monthly goal is to link 100% of citizens of encounters to care, and we've reached our monthly target. I presented last month during the tornado response, which continues. We had an uptick of individuals needing linkage to care. For environmental health, our goal is to reduce food-related illnesses through restaurant inspections, but we have been met with challenges with completing these inspections on time. Parts of the reasons for this is we have a supervisor position that's been vacated. Additionally, the tracking software causes some restaurants, particularly seasonal establishments, require more inspections, up to 3 per year, to be flagged as late because the second or third inspection has not happened yet. So some of these numbers we need to dive deeper into to see if they're actually late or if they're seasonal. We are currently working on a QI project to address these challenges and look forward to shaping our progress. Animal care and control. On the right page here. Although officers were met with additional duties and several more wandering animals than normal after the tornado impact, the team was still able to exceed their monthly target of closing 90% of requests within 14 days. For outreach, Shantae's team from April to June, our outreach and social media efforts were driven by both planned initiatives and urgent community needs. In April, we celebrated Public Health Week with a strong social media push highlighting the CHIP themes each day, and we launched a public health advocacy campaign to wrap up the week. In May and June, our focus obviously shifted to tornado and community resilience, and through response outreach and intentional partnerships. Outreach during the heat advisory through canvassing efforts and resource distribution. And also we shared on social media FEMA updates, cooling center information, heat, and mosquito safety. So that is really my presentation. I'm open to take questions.
I have a question. You had mentioned that it can be challenging to um, host the women's health events because there's additional scrutiny and work that needs to go into screening partners or yeah. What could this board do to either help you find the kind of partners that you're seeking for these events? Or yeah, I guess I'm looking to hear more about what you need so we can maybe understand how we can help. And I do see that Dr. Tepe has her hand up too.
Yeah, so I know there's some issues with some specifications that are required for So Me Healthy Women and Wise Women specifically. I can follow up with the team to find out specifically what the issues were for the vetting processes and the challenges at the venues. And get back to this board.
Thanks. Melissa, I see your hand up.
Sure. Thanks, April. This is just from a clinician perspective, not my original comment. The Wise Woman program is wonderful, but there is quite a bit of paperwork involved in the navigation to services. And on the clinical side, one of the interesting criteria for a screening mammogram is that you must have a clinical breast exam within 4 months, which is not part of professional guidelines. And I think generally speaking, folks that use this program, clinicians anyway, and organizations are aware of that, but that is another barrier that we all need to navigate. I do believe some folks in the state are aware. I'm not sure there's an appetite to rock the funding boat per se, to change that recommendation. Anyway, my other comment was just going to be about childhood vaccines. I know in primary care, right? Private practices, community health centers, hospital systems, we work really hard. Affinia was part of like the NBC did a piece, right? And St. Louis was highlighted as childhood vaccination rates drop here in the city below threshold. They were talking about measles specifically, but everything so that again, reach out to us, all that we can do to partner with the schools. There's a lot of vaccine hesitancy out there, more than there has been before. At Affinia, we saw for the first time our numbers for the childhood physical exams and wellness visits went up before school started, and vaccine rates actually went down a little bit, which means it's more hesitancy, more education, and some parents are declining. And while we want to be respectful of those choices, right, we also want to make sure that there's enough time and energy for education and shared decision making. And perhaps there's something with public health to just continue. I know we do this, but continue, public and community education around vaccine safety and efficacy, really showing the medical evidence, because this is really confusing right now. And there are many different recommendations coming out of, professional agencies with evidence and our government.
Yes, we've done a push right before the school year. We were actively involved with the Urban League after school event. And I think Shantae is also working on an outreach strategy, like a mobile outreach strategy to increase vaccination with the schools. I do know, and we're entering respiratory season now. And so I believe it's the first week of October. We are going to be pushing out Dr. Tapey several messages around, flu vaccine and safety. And so noted that we will make sure we include the evidence base and all of that. I did learn though in Missouri, I went to my primary care physician and I was asking about flu, and whether or not I needed the COVID test, I mean, not test, vaccine. And she said in Missouri, you can't get a COVID vaccine unless you're clinically indicated. So that you have an underlying condition, or so I wasn't eligible for the vaccine in Missouri. So that's a challenge, I think, if we, if people want the vaccine and because they're healthy individuals, they can't get it, even though they are at risk of getting COVID.
No, access is going to be super confusing this year. Affinia, I'm not sure it's for all the community health centers, but we haven't been able to order our COVID vaccines yet. When we get them, right, we'll have to follow certain rules for like community events and things like that, right? Sticking more with like CDC guidelines. When it comes to a clinician visit though, in office, right, that's shared decision making. So, evidence-based, right? So if I have a healthy adult that really wants it, and shared decision-making, right, with risk benefits, efficacy, I can give that. But right, a pharmacist may not be able to give it, right? Like your easier maybe access points for much of the community, it will be very disjointed.
Dr. Tepe, thank you so much for sharing your thoughts and what you are seeing as a path, at least when you have patients in your office, in your clinic. I'm wondering, are there some communication tools that we as just, residents and community members should use or should have access to when we, encounter friends, family, neighbors who might have questions or who indicate that they don't feel comfortable with vaccines? Like what is or is there a tool that can help kind of the average person communicate to neighbors? Because I know that there is an element of distrust that some people have towards the evidence and the medicine and the science of it all. But just because this feels like the COVID vaccine era somewhat all over again. And there were some, I don't know what they were, but I know I had access to some tools and some language that I found helpful when I was just encountering people who had questions or thoughts.
Easy, I think, is hard. It might be great for the department if there is time to put together something, I would say, more from professional societies at the moment. I have not looked at the CDC website today. That would usually be our go-to, but it has been changing and things have been coming down. And so I'm not it's hard to recommend that all the time with various changes. Sorry for my dog. But putting together information from professional societies is likely the most evidence-based strategy at this point.
Thank you. Are there other questions about some of the information that Victoria has shared?
I just wanted to add a little bit to the confusion that, so, if we're thinking anecdotally, we have some pharmacies that actually don't care and they don't ask if you have a reason to get the COVID vaccine. So I would consider keep pushing on all of the fronts is kind of what I'm thinking. That's going to be my current strategy, and not ideal, but it's what we got.
Morgan has asked in the chat if pregnancy is a condition that qualifies someone for and I'm assuming you say the vaccine, Morgan, you mean the COVID vaccine.
So I'm not sure how they word it. ACOG, which is our professional society for obviously obstetrics and gynecology, recommends the COVID vaccine in pregnancy. The CDC, or the federal government, is currently not recommending the COVID vaccine for pregnant women or many children. So likely that is not a condition that qualifies. But again, our professional society continues to recommend it based on the evidence that it is safe in pregnancy and that it also prevents maternal and infant morbidity and mortality.
I will also add to Enlil's point, oftentimes the pharmacy screening question is, do you have a condition that puts you at higher risk? And so if you are pregnant, the answer to that is yes, despite what Melissa just shared about the CDC and ACIP recommendations changing. ACOG and every OBGYN in the entire world believes that pregnancy puts you at higher risk. And so encouraging folks to be creative.
Got it. Thanks so much.
That was a good question. So thank you for asking. Okay. If there are no other questions, I'm going to move us along. Okay. As I stated at the top of the meeting, I did not get any questions that would be follow-up from our last meeting. So why don't we move directly into board committee updates? And I will just start off by saying that governance is still working to make some edits to the bylaws so that we are in compliance with ordinance 71994. I think I said that right. We do still plan to come to the October meeting with some at least initial thoughts on what the board as a whole should approve as changes. You would be getting those prior to the meeting, so you will have time to look at those. And the other update, which will be posed actually to the board after this meeting, is that I've been in touch with the city councilor's office regarding the sunshine training that we need to do some point this fall. And so as soon as they tell me the length of the training, I will then reach out to this group with some possible dates and times to see when we can meet and complete our training. And I'll also find out if there will be some either virtual or asynchronous training options, because I know it will be difficult to get us all in the same space at the same time. But hopefully we can do that before October 31st, which is the deadline, I believe, that has been set by the ordinance that we need to follow now. So keep your eyes peeled for some details about that. We also need to undergo some Robert's rules training. Still getting details about who might be offering that. City councilor's office didn't indicate they were the folks who would be doing that. So I will have to figure that out, or perhaps Craig or Victoria, if you know the right people to call about that, that would be great. But we can talk about that offline. Okay. Next, we'll move on to community engagement. And Chris, I believe you are doing the update in Kristen's place. Dr. Daly, are you there?
Yes, I'm here. I'm sorry about that. Had an audio mess up. But yeah, so this is the community engagement update. So we met earlier this month. And anybody feel free to chime in whenever. But basically some quick items that we discussed and action items to follow up on is that we want to clarify the city partnerships for vaccine campaign, investigate some of the department's current and potential capacity to conduct continue wellness checks, provide direct care during outreach, and support individuals reluctant to leave unsafe housing. And then also request a few details on the department's upcoming educational programs and events, composition and training of the department's outreach team, and then also resources currently being disseminated to the community. So that's pretty much all I have for the community engagement update, but anybody else willing to chime in on specifics, feel free.
Well, that was great. Thank you.
Mhm.
And then we have academic partnerships. Do you have an update, Dr. Shockham?
Yeah, sure. We met yesterday or the other day. We had a lot of discussion on internships and solidifying some of those best practices. So we're working on collecting everybody's current processes and then see how we can support the Department of Health to kind of demand a better plan for some of them. And I think there seems to be a lot of partnership in that goal. Lindenwood University is going to join our academic partnerships. Thanks to Chris, we had a good opportunity to bring them along, and they are already partners with the Department of Health and having interns. So we wanted to see how we can solidify some of that. Then lastly, Morgan came up with this delightful idea. I keep reading about this potential, but bringing together academic partners and health departments, in addition to other health departments beyond St. Louis City Department of Health, and having a day of learning, meet and greet, and growing research and practice opportunities. So that partnership can and will be wonderful. We're looking for funding opportunities, and I'm on board with Morgan and this engagement award through PCORI. We'll see. I'm going to follow up on emails and see who's going to lead it, but let's do this, or at least try.
Yes, I think we have ideas. There would be a lot of details to hammer out. And we are going to submit a letter of interest to PCORI, which is due soon, I think next week. And just we'll see. And that's for about 125,000, which is specifically for something like this, where you're like bringing people together, organizing a conference. So we're at early stages of conceptualizing this.
That sounds amazing. Wow. I might have thoughts on other organizations that maybe could help fund or could help to organize. But it might be helpful for me. I'm sorry I was not able to attend. It might be helpful for me though to know who's already kind of on board. So I will reach out to you and Bull after this meeting about that.
And Emil, it's Deidre. I have a question about the internship best practices you mentioned. I wondered if you could share a little more about that, or maybe just offline. Also, I mean, we have in my department 2 to 3 internships annually. So if this body is a good place to disseminate those, and I don't know if we have a mechanism for just sharing internship opportunities. We can always use help getting great interns for those spots.
Well, I love that, Deidre.
I'm always here to give you good interns. But in this hat, I will say we can collectively, I mean, it's not something we had done before, but there's no reason we don't. And I think that Dr. Monti had outlined like, hey, can we get an internship set up where it's a longer period of time? Not so because the learning curve is so high and it's so steep and it's challenging for staff and faculty mentors and a preceptor to all be a part of it and not be a part of it at the same time. So we're suggesting, making strong recommendations that we have a longer term, so ideally a year-long internship, having a faculty mentor plus a preceptor from the university side, and then from the staffing side to have, or from the Department of Health to say, these are the projects you're going to work on. These are the projects we need somebody to work on, and then match them that way. So it's not like, hey, we have an intern. But Deidre, send them
Send it your way. Well, I know.
one over.
You.
Thank you.
Sounds good. Thanks.
Okay. Any other feedback or questions?
Yeah, I do have a quick question. Just a request, like going forward, could each committee possibly send out like their notes before the meeting so we can prepare?
That is an excellent segue to what I was going to share next, Chris.
Cool.
So as we have talked about on the board for, I don't know, several months, we needed to create some kind of, infrastructure so that we could share and have like a single place of truth for all the documents that we wanted to have access to, whether it's making sure everyone can go into a file and find bylaws, department structure, reference documents. And so the department has graciously started a Google folder for us that we now can use to make sure that we can hold the knowledge and the work that we are doing in a singular place. I will send out a link to each of you using the email that I use when I send out the agenda every month, because it will be a very limited group of us that have access to this folder. But you will find like a folder for our reference documents. So for those who are new and who have not yet gone through a formal kind of onboarding, some of those documents will be living there. And we have not yet had a place where those things live. So I am excited that we can formalize that. And so to your point, Chris, what I'm going to ask before meetings in the future, starting with October, and whoever wants to help create a template for it, that's fine. But either like a Google form where committee chairs put in their notes or their updates for the following meeting, so that it can populate into a tool that everyone then will have access to read before the meeting. So folks can come to the meeting and ask either more relevant or pointed or pertinent questions. We'll also be keeping meeting agendas in this folder, the quarterly reports, any presentations that we are offered during meetings. So I'm looking forward to having a spot for us to actually visit. And I also welcome any feedback once you all have a chance to look at this folder, because it's, it has very general information in it. So if there's something that you all feel very strongly we either need to add or need to organize differently, please let me or Kristen know. And yes, definitely want to shout out again that the department is helping us with this. So this is something that is hosted on the DOH Google Drive. And so thank you for sharing your Google Drive space with us so that we can stay organized and efficient as a body. So does anyone have any questions about that? You'll be getting a link this afternoon.
Thank you, April, for organizing that, facilitating that process.
Well, just to be clear, I did not organize. I just asked for help
Okay, well, the
getting it done.
Department of Health, thank you all so
Department of
much.
Health, Shantae and
Shantae always comes through.
yes, Anika, who actually just, created our folders for us. So
Okay.
before we move on, at the top of the meeting, our newest board member had not yet joined us because I believe, maybe were you on a plane?
Yep. Hi, I'm in the Dallas airport right now.
Okay. Well, thank you so much for making time to join in the midst of your travels. But want to certainly give you a couple of minutes that you can tell the rest of the board and the staff about you. And we are excited that you are a member of the board. I will let you tell the team.
Thanks, April. Hi, folks. My name is Nebu Colin-Cherry. I'm super excited and honored to be a part of this group. I happen to know about half of you, which is a real treat. Commissioner Unworry, Craig, good to see y'all. Thank you for all the amazing work that you do. My background, I've worked in public health for the last 10 years or so, and my professional roles have been I started out my career at the CDC and then went into consulting with the Department of Defense. Immediately prior to this, my current role, I was at the county health department. Actually, I was their division director for communicable disease response. So did a lot of work on the second half of the COVID response, as well as led the Mpox response for the region. I did a lot of work with sexual health and TB as well. Now I am I work for a company called Flourish and Thrive Labs, and we work with state and local health departments across the country, primarily on data modernization projects. So right now that's just means a lot of AI work, and trying to think through how public health departments can use AI safely. So really excited to serve on this board and be of use to the health department. Thanks, April.
Thank you. I think we can all say we are very happy to have you serving on this board. And one of the things that both you and Deidre will be asked to do in the next few days is to indicate your interest in terms of committee or committees that you want to serve on. But I will email both of you separately about that. Okay. All right. I'm going to go ahead and move on to the next item. So over the past several months, as you all know, Kristen and I have been working to get a meeting with Mayor Spencer so that we can hear directly from the mayor and possibly from others on the mayor's team about areas of focus that she wants to prioritize in the in DOH and public health philosophy more generally. And so she will be joining us at the October meeting. My question for this body is really centered around if there are specific questions or topics that you all would like for her to address. We'll probably have 30 to 40 minutes of her time. I'm going to be sending that as a separate email. So there's going to be a whole lot of stuff you're going to be getting from me at the end of this meeting later today. One of those questions or those action items will be for you all to enter into a Google Doc that we will share, questions or topics. But if folks have, initial thoughts, you can certainly share those now. Otherwise, you can take some time to think about what you would like her to address or cover. And we plan to send that over to her office in a couple of weeks. Okay.
I do have a quick question. I know there was a notion made earlier about a list of what we do sent to the Department of Health, but could we send that to the office too? So she has that.
Yeah. Yes. That's a great point. Yeah. Any other thoughts?
Yeah, I do have another question too. Is there a limit? Are we putting a limit on questions for each board member?
What I'm going to do is I'm going to ask everyone to put their thoughts on paper or virtually. And then we're going to look and see how many questions we think are probably feasible or, reasonable. It's not a lot of time. But if we have a lot of questions, we'll probably circle back to this group to ask folks to rank how you would like her to, address any key topics. So that will be in your hands as or our hands as a collective group.
Okay. And we plan on putting like dates for this, like deadlines to put
Yes.
certain okay.
Yeah.
Good.
So I don't have the exact date in my mind, but you'll get an email asking you to complete your list of questions in a document over the next week and a half or 2 weeks. So we want to make sure that she has, at least a couple of weeks to prep.
Sounds good. Thank you.
Okay. All right. All right. Let's move on to board advocacy and engagement. Brittany, you want to give that update in Kristen's place?
Sure. Let's see. On September 4th, I was able to make a public comment to the Board of Budget and Public Employees Committee, essentially just reading our letter that we've drafted and sent over. There were around, I want to say maybe about 15 speakers who spoke to their individual and what they've noticed within community around how the tornado has impacted them. A lot of the stories were very moving and there was a lot of passion in the room. Unfortunately, I had to be there virtually, which wasn't the funnest, but I was there. And the city, right now, what it seems to be, the city is focused on debris removal and home repair. And so their intent between now and 2027 will be housing stabilization, debris removal, resident support, public infrastructure restoration, and communal infrastructure. I did not hear nor note much communication or comments that were made directly to support the Department of Health. So it would be helpful for us to continue to advocate at public hearings on our behalf and the behalf of the Health Department. And potentially, this can also be a conversation with the mayor. So that's pretty much what I've gathered from that public hearing.
Well, thank you for attending and making sure that our collective voice as a board was heard. I do want to note that any letters that we send as a board body will also be saved in our shared Google folder. So if anyone ever wants to go back and read what we have shared you can certainly find it there. Anyone else have questions or comments for Brittany or insights? Okay. I'm going to move on to announcements. We have spoken over the past, I don't know, several months about the fact that it would be really helpful if committees knew more about the work that our other committee peers were doing, and that we wanted to try to schedule a joint meeting. So you'll also be getting a doodle for that. One of the reasons that we wanted to engage us all separately and not in a board meeting is that for all of the information that we ask, DOH to offer to us, and the dialogue that we have with them about their team's work, it wouldn't be possible probably to also do that for a kind of joint committee meeting, and that should be held separately. So we want to make space for it, and also to allow time for board members to, engage in some dialogue collectively around direction that each of these committees should be moving towards, or what we should be moving towards as a full board. So we're going to try to find time for that this fall. If the doodle is unsuccessful, we'll try another round, and we are open to both virtual and in person. I don't know that we have a hybrid option, but if we find a location that allows for that to be a fruitful option, because hybrid is tricky, then we can think about that too. But you can look out for that. So to summarize, you all are going to get a massive email from me with a lot of links and asks. And you'll be getting information about the chip that we heard today, including how to reach out to Kat. Kat, I will send you a list of all of our board members and our affiliations. You'll be getting a doodle for the sunshine training and some hopefully updates about Robert's Rules of Order training. And then you'll be getting this doodle about this joint committee meeting, so we can clarify our role and purpose in the work that we are doing. We are an advisory board, not a governing board. So our role and our duty is to advise and support the work that Commissioner Worry and her team are doing. And we want to be really mindful of that we do not, start to overstep our duties here. So we want to be in partnership. So prior to any joint meetings taking place, Victoria, I will reach out to you as we think about agenda planning, and you would be welcome to come to that meeting too. Okay. That's all I have, I believe. I'm looking through the chat really quick to make sure I haven't missed something. Okay. Are there any other announcements?
Yes.
Good
Thank you,
news,
April, for the
partnerships?
announcement.
Yeah.
This is separate. I meant to share this at our last meeting, but I want to share some updates. with what I'm doing currently. So I'm at Lindenwood now. I teach anatomy and physiology. So I have freshmen through senior students, undergraduate students. I'm also in my MBA at UCM, and I just started my business here soon. It's called Wellness and Relief. We do educational and healthcare services are coming soon here in the fall. So definitely want to share that announcement with the group. And I did graduate from the community fellows research training program at WashU. So, some alumni in the room, Craig and Brittany. So just wanted to share that with everyone with a quick update. So thank you.
Great news. Con congrats for all the things. I would love to hear more. Maybe we can chat when we meet offline, but about how you are experiencing Lindenwood and what you see as potential partnership. I was super excited that you were able to connect Lindenwood to the work that the board is doing in terms of partnership, but also just want to hear more about what you're doing. So that
Let's do
is
it.
really, really great news. Does
Thank
anyone
you.
else have any positive news to share? I feel like we need a timeline cleanse. So if there's if there's positive news, please share it. Well, I hope there are positive things happening for people. We're at the end of our meeting. I want to thank all of you for, as always, being so engaged and active. Thank you so much, Kat, for coming to the meeting and sharing more about updates on the chip. There's just a lot of very exciting work taking place, and clearly a lot of people who are partnering to make that work. So we have our next meeting on October 16th. The mayor will be attending. So I look forward to seeing the topics and the questions that members of the board might have for the mayor. But you all will be able to do that and get access to our new board folder when I send a follow-up out to this group. That being said, it is 9:20 and I'm going to adjourn our meeting.